Hello, my name's Tony Buchta. I'm the owner of Central Ohio Compounding Pharmacy. We're located in Columbus, Ohio. And I'm here today with my good friend John Herr. John's a compounding pharmacist that owns Town & Country Compounding Pharmacy in Ramsey, New Jersey. We've been in practice for over 25 years, and one area of specialty we have is men's health. And that's what we're going to talk about today. In particular, the journey that men have to travel dealing with erectile dysfunction. Erectile dysfunction is very common, often not talked about, and it should be. It can happen for a variety of reasons. It could be as a result of disease, medication therapy, possibly a result of a surgery, or just natural aging. But there's a lot of treatment options out there to address these problems. We're looking forward to working with you and your physician to customize your personalized care so we can help you achieve your results that you're looking for. Many patients suffering from erectile dysfunction will use a penile injection, like TriMix or Quadmix. It's a very simple injection, but for patients who have difficulty with it, we have a device to solve that problem called the Auto-Injector.
So Tony, why would a man choose to use an auto-injector instead of simply using a syringe like many men do?
Yeah, good question, John. For some people, they may have difficulty manipulating the syringe, they may have arthritis, or they may just be afraid of needles. The auto-injector will provide a very user-friendly solution to solve that problem.
And I think now we're going to demonstrate how you adjust and load the auto-injector and how it is used. When utilizing the auto-injector, it's very important that you have the ejector set to the correct syringe. I have two syringes here just to show you. This is the one we typically use for TriMix and Quadmix. You'll notice the needle is very short. But here's another syringe that has a longer needle. It's imperative that it be adjusted so that you get approximately 6 millimeters of penetration with the auto-injector. Now that's just a rule of thumb. The 6 millimeters is a starting point. Some men may require either a shorter injection length or a longer injection length, but we always recommend that you start with the 6 millimeters. So this is your injector kit, and I want to go over the components and then the assembly. The first component is actually the injection housing. Then it's the injector body. The injector body is where the syringe sits. Then we have two different depth gauges. These two depth gauges are utilized according to the syringe that you are making your injection with. So we have the larger and then the shorter depth gauge. And then we have a gauge plunger, and it's also used to measure that the needle depth gauge has been set appropriately. In the kit, there's a little manual. And again, you can always call the pharmacy and we can refer you to the depth that you should start with your setting. And we can even keep that in your profile. But in the manual, it tells you the depth according to the different syringe that you're going to use. So I've already looked this one up, and we'll use the shorter syringe for demonstration purposes. And I know that 6 millimeters of penetration corresponds to the shorter gauge, and it's the M. And if you'll notice, it's hard to see here, but there's letters on here. So there's an M, and I'm going to set the M in here in the syringe housing. It screws in very simply. And you just keep screwing it until you get to the M, which again, that should give us our 6 millimeters. Okay, now I am at the M, but I want to make sure I really do have that. So what I do is I take my syringe. It's not loaded now. You know, the plunger is not pulled out as if there was medication in it. We leave it like that and just simply drop it in. You drop it in and then press, because there's a little spring action in there. And now the needle is protruding. So I take my depth adjuster and I just hold it. And now I can see that I have set it to deliver a 6 millimeter injection. What I would do now is I would take my vial and I would load my syringe according to the prescribed dose by my physician. For example, if I was injecting 20 units, I would have 20 units or 0.2 cc's of medication in my syringe. Now what I do is I take this depth adjuster, and it's actually our plunger too, to actually cock the housing. So we just insert it until it's seated there. Now the depth adjuster is all the way inserted in, and we just take it here and we just press, and you'll hear a click. And you can see that the rod is now sticking out. After we make the injection, you'll notice that the rod will actually go back down into the housing. And what that indicates is that the injection has been completed. We now remove the depth gauge. We take our syringe that we've loaded. We just drop it in. Now you'll notice the plunger is out because the medication is loaded in the syringe. Just drops right in. This then screws right on. You just keep screwing it until it's seated. The main thing too is if you notice there's a red in this window here, that's like a safety. So if I was to press the trigger right now, nothing happens. It actually has to be, firmly pressed against the shaft of the penis. If you notice how it goes in and the red disappears. At that point, you're ready to press the trigger. Now for demonstration purposes, we have a medical anatomical model. We discussed this earlier about injection technique, and just as a reminder, we do not want to inject in the top where there's a lot of nerve endings. We tend to suggest the 10 and 2 position on the shaft of the penis. So now I can take my injector. And again, we would hold it firmly. I'm going at that 10 o'clock position. And now as you see, as I press it firmly against the shaft of the penis, that red disappears. Now I just simply have to press the button. And when I press the button, watch that the black plunger rod is going to go down. See how quick and easy that was? Less than 5 seconds. Now I can just simply pull this straight out, lay that down, and apply pressure to the area of the penis where I made the injection, as we discussed in our injection technique video. So Tony, what are some common questions you get from your patients regarding the auto-injector, or do you have any tips that you'd like to share with some of the patients?
Sure, John. I think that's a great question. I think one of the big challenges that men have getting started with this is just some of the apprehension to make sure they have the right depth set for their particular needle. So we go over that and find the proper setting. They can refer back to the manual and use the depth gauge before they get started. And I often tell them to check it a couple times just to make sure, because if it's too deep or not deep enough, it's going to affect how effective the erection is and how quickly it occurs. The important thing is once we get it set and have the proper needle selected, we'll record that information in their patient profile. We'll ensure they consistently get the same type of syringe each time, which will ensure proper depth. They're not going to need to change that each time. If you feel that this device is right for you and you'd like to use it, it's available without a prescription. So you can either stop in the pharmacy or we can mail it directly to you. Either way, there's someone that's going to be there to help you answer the questions. I'd encourage you to refer back to the video that we've put together just to help take out some of these questions and make sure you have a successful outcome with the injector.